So Katy, can you introduce yourself?
Sure, so I'm Katy MacLeod and I am one of the National and Training Development Officers for ScottishDrugsForum. Recently I've been working on this Scottish Government commissioned research for SDF.
And can you say a little about yourself in terms of your own experience and your perception of how NPS use has changed the home drug scene in Scotland, say, in the last 6-7 years?
Yeah, there's been quite a lot of changes, I suppose. Certainly around 2009 was a time that I noticed a lot of changes. We saw the emergence of drugs like methadone, which was one of the most popular drugs for a period of time, and then there was a lot of legislative changes in 2010 following that emergence, and then we started to see more laterally synthetic versions of cannabis, so synthetic cannabinoids come in, and I guess different substances have fluctuated in popularity, and then some have never went away, and then some have appeared and disappeared very quickly in response to the legislation.
And of course the research came out of that kind of confusing picture about what was going on. Would you like to talk a wee bit about the process in terms of how you went about doing the research?
So the Scottish Government, out of a process of analytical work, put the tender out for this piece of research, and in combination with Glasgow University, ScottishDrugsForum successfully achieved that tender. And the process really involved initially planning out the research and identifying target groups. So we identified the target groups for this study as people in contact with mental health services, people that at some point experienced homelessness, vulnerable young people, men that have sex with men, and people who inject drugs. Once we identified the target groups, the next stage was to look at ethical approval so we could get into services, and we had that for across Scotland. And we had two main stages of the research. The first bit was about doing qualitative interviews with people who had used NPS, and also doing some focus groups with staff. And from those findings, we developed the survey tool because we really felt it was important that we asked the right questions and not what we as professionals thought we should be asking. So once we developed the two survey tools, one for staff and then one for service users, and we did data collection over a number of months, and this is us just concluding the write-up now.
So in terms of those target groups, those vulnerable populations, what did you find in terms of the patterns of their use and the motives for use and the harms?
So I guess with the patterns, the biggest finding for me was actually how many people actually used with traditional drugs. So there was actually only one person out of the survey sample that solely used NPS. So that's possibly different from the public perception of NPS. It was, maybe people that never used other drugs before. And then other patterns, I guess the most popular in Scotland were the drugs that mimic Valium, so benzodiazepine type new psychoactive substances, and also the synthetic cannabinoids. They were the most commonly used. So that kind of captured the patterns. And then looking at the harms, probably the biggest harms that were identified were around mental health, so anxiety, depression, and to a lesser extent things like paranoia. And the biggest physical harm across all the groups was probably around sleep. And to a much lesser extent, things like seizures came up, but that was much more infrequent. So I guess that was interesting in itself, that people do experience harms, but not necessarily the acute harms that we're maybe used to reading in the media. So that's not to say that people aren't experiencing some harms, but it's maybe the more extreme cases are less typical of the picture in Scotland, and it's maybe harms from a number of substances being used together as well.
And in terms of those vulnerable populations, there was kind of spectrum of vulnerability even within each group. So can you talk a little about the impact on those at the end of that spectrum who are the most vulnerable?
Absolutely. So I think one of the biggest things for me in this study was there was a really big overlap between people who injected drugs, homelessness, and people who had experienced mental health. So even when we were recruiting from services, we were noticing that this had a substantial overlap, and what that told me was that actually a lot of the people that we're talking about that are using these substances and experiencing problems have a range of different barriers and issues to face. And indeed, one of the findings around some of the social harms was around missed appointments. So I think it was around 60% had reported missing appointments. And this is potentially a group that were already more vulnerable to things like welfare reform, benefit sanctions, and had been affected by things like homelessness as well. So this issue would likely have caused even more harm to an already at-risk population.
And of course the fieldwork was done at the time that the Psychoactive Substances Act was coming into force. So what part does legality play, or illegality, and have you any impression of the impact of the Act?
Yeah, it was really interesting timing with the research being just at the same time. So, of course, we have to caveat the findings to say that this is what people said that they would do as a result of the ban, as the ban was just coming in. So actually a significant amount of the sample said it would have no impact whatsoever. And just over a quarter said that they would move or return to using traditional drugs. So they were some interesting findings, and indeed findings that we definitely want to monitor closely, because they would involve things like greater risk of overdose, where people maybe had got accustomed to using other drugs and then returned to, say, a drug of choice such as heroin, where overdose would be a particular concern. So it will be really interesting to see what does happen, maybe in the future.
And of course you wear several hats, and one of those hats is in supporting people who have a need for welfare support at music festivals and so on. So in terms of that work, when you were looking at the report, do you see a chime between those two areas? Does it reflect what you're seeing in the field in terms of people's harms and people's experiences?
Yeah, and I think with the harms, so again, acute harms, that is a small percentage of people that will use drugs, and it's really important to contextualise that. So certainly some of the work I see out in the field is like that. You remember the cases that are very intense, but actually that is a minority of people that are actually using the substances. But maybe some of the findings that was most important was around motives, why people actually use drugs in the first place. And I think this research gives a bit of insight into that I see crossover with my other work. So the actual pleasure is a very big motivator, and absence of pleasure, so where people stop liking the substance, that is one of the biggest factors in deciding not to continue using a substance. And that was something that certainly came out from this. So not liking it and experiencing acute harms were the main factors, rather than legality for either trying or continuing to use.
So the report's been published and we have a hard copy here, but what's your hopes for the impact of it? What would you like to see happening as a result of the research and your work on it?
I think the biggest thing for me is around some of our learning about treatment and information as well. So there was various needs identified around where people actually source information about substances that I think we could learn from. So in this sample, actually quite a number of people didn't source any information about them at all. So that highlights important learning for us, particularly around prevention and harm reduction. But equally that the role of peer education, so a lot of people talked about learning from friends and people that they used with, and maybe it's about doing more of that work. Things like assertive outreach were other things that potentially could be explored, maybe utilising peer education type models as well. So I really think I'd like to see learning from the treatment side of things from this.
So in terms of the simplest piece of advice you would have, what comes out of the research in terms of service response and initial engagement with the services?
Yeah, there was some interesting findings from particularly some of the staff findings, but also in the service user survey, which talked about knowledge about NPS itself, and potentially a gap in workers' knowledge and asking the right question. That came out very much in the qualitative part with frontline workers, where people identified in the focus groups that it was really important to ask directly about NPS to elicit the correct answers. And indeed, even from the findings of the whole survey, only 11% said they were specifically in treatment for NPS use, even though they were in services for often multiple reasons. So that highlighted a real gap in people actually disclosing NPS use. So a big learning point for me would be thinking about how people assess and actually introduce asking about newer drugs, and potentially thinking about asking directly.
And do staff or services themselves shy away from that because they feel as if it's something that they're not expert on, or they don't have some specialist knowledge that they should have?
Yeah, and that again, that came up from the staff responses. They talked about the challenge of keeping up to date and sometimes feeling out of depth, and indeed service users also identified that sometimes when they did discuss, staff maybe didn't know the depth as they did with other drugs, and I think that's something that we've seen with other types of drugs as well. So this isn't a new phenomenon, so it's really thinking about asking, and the client as the expert, but also us as workers knowing where to get information and upskill ourselves, thinking about those things as well.
Well, Katy, thank you very much.